Hi guys, okay, let's do chapter 82, Blood and Lymph Disorders on page 1454. Now, this is a long chapter. My goal is to just condense it real quick, hopefully only 20-30 minutes, and then we'll be done. So, I'm not going to go into great detail on a lot of these subjects. I'm going to just highlight the most important things that I think are important. But I do expect you to read the chapter and be familiar with it because it'll only make you more successful, yada, 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 yada. However, I want to let you guys know my baby is right here. So in case she starts crying, that's what's happening. Hi. Okay, so chapter 82, Blood and Lymph Disorders. Oh, again, anything that's important I will put in the description box to help you prepare for any pub quizzes. Okay, basically it kind of talks about blah, blah, blah. Diagnostic tests, super important. Pretty much every single patient is going to get one of these because what's in the blood is going to determine a lot of what's going on with the patient. So it's really important. You're just going to get that blood and just call it good. So diagnostic tests. Laboratory examination of blood can reveal the general condition of many body systems and can aid in the diagnosis of many disorders. Tons of people can perform it, phlebotomists, all the way to the top. Blah, blah, blah. So another thing is blood typing. So important to know these things because giving the person the wrong type of blood will kill them, possibly. So ABO blood typing, the 4 types of blood types that we talked in chapter 23, A, B, AB, and O. So it also talks about different types of antigens and antibodies. Just know that type O is the universal donor. You can give type O to anybody. However, type O's can only receive O blood. AB blood types, so AB, connected, they're the universal recipient. Basically, anybody can donate blood to them. Doesn't matter. So that's really nice, but they pretty much can't donate their blood to anybody else except for AB patients. So, also know that there's what's called an RH factor, and that can spend a whole chapter getting onto that, but that's the positive and the negative. Again, it's that D antigen, the D factor that is found in the immunoglobulins or whatever, back in chapter 23. So knowing what that is, it's really important. The most important reason why it's important is for pregnant women. I am O negative. If my baby came out with an RH positive factor or anything like that, I would have had to get what's called the RhoGAM shot, which would have counteracted those antibodies from developing in my system. That's why O negative blood I think is the rarest, because for generations and for human existence, babies or moms with O negative blood, basically if the first baby was not O negative or was an RH negative baby, she's going to build antibodies against the other babies. And the RhoGAM shot didn't come out, I think, until like the 70s. So it's fairly new. Luckily, my baby's O negative. So that's awesome. That's awesome. Okay, so cool things. And then there's different types of blood tests to cross match or whatever. Just know on page 1, let me see here, where is it? Here we go. So on page 1460, I'm jumping ahead, on data gathering and nursing 82.2, blood transfusion reactions. Those are important to know. So when you do a blood transfusion or you're giving any blood to anybody, you need to monitor them for the first 10 to 15 minutes, and you need to double check the blood with another licensed healthcare provider. Usually it's another nurse. You go in there and you each type in that you verified it. You're going to scan everything. Oh no, she's pooping. You're going to scan everything and make sure it's okay. That's a big poop. So just know, check for fevers, chills, shaking or muscle aches or flank pain is important. Back pain, chest pain, headache, pain at site of infusion or along the vein. And there's other things that go into it. I'm not going to go into depth. Page 1460, you can look at those. Just know the general reactions, okay? Okay, back to page 1455, 1455. I'm going to go down on what's called this complete blood count. The complete blood count is the common analysis of blood that provides diagnostic information. A CBC, complete blood count, usually includes a numerical estimate of the number of red blood cells, white blood cells, and platelets found in a blood sample. So it goes on to saying all kinds of things, and then it says this is what it includes. There's a whole list of things that they look at. You will get a CBC and another type of blood count, a BMP. So you're almost always going to get a CBC. Basically, they want to check your white blood cell count and your blood levels, your H&H, hemoglobin, hematocrit. Those are important things to know, and then it has different things that can kind of get into more detail. So then it talks about what the red blood cell count is. Just know that they check for your blood levels. Also know with a client who has adequate overall hydration, the hematocrit result is about 3 times the hemoglobin, okay? Okay, so then it talks about the white blood cell count. A white blood cell count is a valuable diagnostic aid. When an infection is present, the normal count of 5,000 to 10,000 may increase to 25,000 or higher. White blood cells increase in number, which are called leukocytosis, or decrease in number, which is leukopenia. So again, I'm just going to kind of like jump through the most important things that I think is really good to emphasize. In diseases, the proportion of the kinds of white blood cells varies. Let's see here. In bacterial infections, the number of neutrophils increases. In viral infection, the numbers of lymphocytes increases. Chapter 23 talks about that, but I really liked Chapter 82's information. I thought it was great. So then it calls it out, blah, 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 talks about more stuff. Okay, then the platelet count. The platelet count indicates the client's capacity of hemostasis, which is blood clotting, which is preventing from the blood leaving the body. So low platelet counts are associated with bruising, bleeding disorders, and hemorrhage. That goes back to the petechiae and the purpura that we kind of talked about at the end of the video for Chapter 23. So then it kind of talks about different things about that, la la la. Okay, sweet. So then there's an NCLEX alert on the top of page 1456. So laboratory tests, they say to know the lab value for CBC, blah, blah, blah. Hi, beautiful girl. So coagulation studies. So then you have what's called the prothrombin time, the PT. Is an actual amount of time that it takes blood to clot, generally given in seconds. It can indicate proper functioning of coagulation factors. So PT is important, they check that for sure. The INR, they check that usually to monitor anticoagulation therapy. So in the beginning, when someone's starting on anticoagulation therapy, they're getting tested like every day. And then once it becomes stabilized, they get tested about every 2 weeks. And they literally go in for a blood draw. That's what they do. So normally the prothrombin time is less than 12 seconds. So there can be various reasons why that can be extended. We'll go into that later. Just know when it comes to anticoagulation therapy, specifically warfarin, which is a common thing that people are on. For example, if they have AFib, they want to prevent that clotting, they make the blood thin, blah, blah, blah. Vitamin K reverses the effects of warfarin in 12 to 24 hours. Vitamin K is the antidote to warfarin. Hi, beautiful. You okay? Blah, 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 blah. So good things to know. Okay, then we have partial thromboplastin time, the PTT, or activated partial thromboplastin time, APTTT. These tests used to monitor the pathway of clot formation. So a lot of the time they may be used to monitor heparin anticoagulation therapy, which is super common. They give heparin all the time. So just know that the antidote for heparin is protamine sulfate, kind of what I mentioned before, protamine sulfate. 1 milligram of protamine sulfate will reverse the effects of 100 units of heparin. So just know that nursing alert on page 1457, when a client is on anticoagulation therapy, a normal laboratory value may indicate too little warfarin or heparin. Successful anticoagulation therapies requires a prolonged time for either the PT or the PTT. So PT, prothrombin time for Coumadin, PTT for heparin. Kind of way to differentiate it. Then talks about bleeding time. Okay, so then other hematologic studies. Then you have what's called the erythrocyte sedimentation rate, the ESR. Yes. Basically, the erythrocyte sedimentation rate, ESR, measures the speed of red blood cells settling to the bottom. So the speed with which red blood cells fall to the bottom of the tube corresponds to the degree of inflammation present. They're seeing how long it takes for it to pass through everything and settle to the bottom. It's a non-specific test, but it's useful in diagnosing infections, inflammatory processes, and autoimmune conditions. Let's see here. So then it kind of talks about different things. Then it talks about blood culture. So the next thing is the blood culture. Most important thing about blood culture, get the blood culture before any therapeutic things are administered, such as antibiotics or antivirals, whatever. Get the blood culture with everything else. And almost always, like when it comes to like immune compromised patients, such as like those like cancer patients, you're almost always going to get a blood culture if they have a high temp, because you need to figure that out right away because they're so immune compromised. The chemotherapy and radiation is wiping all of their immune cells out of their body, so they're so susceptible. Blood cultures, blood cultures, blood cultures, blood cultures, blood cultures, blood cultures. Super important. Once you have that, you can get the therapy started right away, so your patient can be treated faster and better outcomes to prevent septic. Anyways, so blood cultures. Basically, it's done to discover the presence of bacteria in the blood or to determine the antibiotics that are most effective against a specific organism. So they're going to just give them antibiotics, but as soon as that blood culture is grown, they're going to be like, okay, this is a specific organism. Now I can just do this antibiotic. That's kind of what they do. Okay, so then we have bone marrow aspiration and biopsy. A bone marrow aspiration biopsy is done to evaluate the number, size, and shape of red blood cells, white blood cells, and megakaryocytes, platelet precursors. The aspirate provides a sample of cells that are examined under a microscope for a biopsy determination. This test can be helpful by assisting in the diagnosis and monitoring of many disorders such as leukemias, hemorrhagic or hemolytic anemias, aplastic anemia, Hodgkins lymphoma, non-Hodgkin lymphoma, multiple myeloma, and infections. Boom. That's awesome. Talks about the procedure and blah, blah, what they do. Lymph node biopsy. It's a biopsy or excision of a lymph node is often performed to diagnose or stage a tumor or to diagnose immunodeficiency disorders. Staging a tumor helps identify its invasiveness. Okay. Common treatments. So then it talks about transfusions of colloid solutions. Colloid solutions, often referred to as plasma expanders, are solutions, but not blood cells. They're used to replace circulating fluid volume. Okay, so again, you're giving colloid to help replace the fluid volume, but it does not replace the blood, but it helps kind of that volume to keep your system circulating. Then it goes down. So colloid solutions are given in critical or emergency situations when a hypotensive client is in jeopardy owing to excessive loss of fluids. Synthetic colloid products are often used if blood products are not available. So for example, recombinant human erythropoietin, EPO, Epogen, Procrit, other names for it, can be given to stimulate red blood cell production. So those are also going to be given with that colloid to help your body like go in hyperdrive and produce all those things. I love you. You doing okay? Okay, so then it talks about transfusions of blood and blood products. We kind of already talked about that. Blood donation, you give your blood. Let's see here. A key concept. Okay, one thing about blood transfusions, some religions and cultures do not allow a person to receive blood. Respect that, follow that, don't ever force them, but make everything very clear to them, the expectations or could be the outcomes of this or that. Also, another key concept, even though it is rare, a blood transfusion can transmit blood-borne diseases such as hepatitis. Tests and procedures for screening blood and selecting blood donors have improved the safety of blood transfusions. When handling tested blood, always follow standard protocol. Always, always, always. Even if that's the most healthy patient in the world, don't even risk anything because you don't want anything from anybody else. You got one life, one body. Some things are not able to be cured. Okay. Let's see here. Then it talks about blood products. So we've talked about different things. I'm going to be really quick on these. So whole blood, that's basically the juice coming out of my arm going to the juice of somebody else. It's rarely used, but we kind of talked about how that one surgeon in Texas was doing that. Kind of cool. Anyways, it can be refrigerated for storage for up to 35 days. So past 35, can't use it. Packed red blood cells can be stored up to 42 days. Platelet concentrates are to prevent or resolve bleeding caused by thrombocytopenia. Fresh frozen plasma contains unconcentrated plasma with clotting factors. Serum albumin. It's used for pressure by pulling interstitial fluids. So again, that 13-month pregnant lady, you're going to give them albumin to help pull that fluid out. You doing okay? Cryoprecipitates. They're used to treat hemophilia and other clotting disorders. And then it has plasmapheresis or apheresis, blah, blah, blah. Immune globulins A family of proteins that act as antibodies include IgA, IgD, IgE, IgM, and IgG. So IgG is the principal immunoglobulin in human serum. It's collected from multiple donors and may be given to a person who has been recently exposed to an infectious disease such as hepatitis. IgD is a major component of RhoGAM, which is used to prevent erythroblastosis fetalis, basically prevent the mother's body from attacking the fetus if they have an opposite Rh factor. So blood administration, again, we talked about that already. We're going to skip all that, blah, blah, blah. No way. No way. That's amazing. Okay, so hematopoietic stem cell transplantation. Okay, so again, on page 1460, there's great blood transfusion reactions in Nursing Care Guidelines 82-2. Know them, just be familiar with them for sure. So, when it comes to stem cell transplantation is a life-saving medical procedure that has been in use for many decades to treat diseases of the blood and bone marrow and certain cancers such as leukemia or multiple myeloma. And then it kind of goes into using specific growth factors, stem cells derived and developed from bone marrow, umbilical cord blood, amniotic fluid, and peripheral blood stem cells. So there's obviously some ethical considerations when it comes to stem cell, just because of the whole fetal and everything. We get into that. I don't really want to get onto it to YouTube, so we can talk about that in discussion, whatever you guys want to do if we want to get into it. Anyways, though, talk some more about things. So just know that when the client receives the donated bone marrow after receiving chemotherapy and or radiation, preliminary results may be seen in 2 to 4 weeks. However, complete recovery with successful transplants may take 6 months to a year. So if they're getting a bone marrow transplant, it could take to 6 months to a year. So just a heads up, and it has to be super specific to each patient. That's why they're like, is anybody connected? And please get tested, blah, blah, blah. That's what that's all about. Aww. So then blah, 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 blah. Talks about complications. You can read all about it. Hematologic system disorders on the bottom of page 1461. So, really brief now, okay? I'm going to just try to keep things as clear as day, and I want you to read this chapter. It's really interesting, okay? Okay, polycythemia means too many red blood cells or erythrocytes in proportion to blood volume. Hematocrit levels of greater than 55% can indicate polycythemia. Talks about different things. The high numbers of red blood cells, as well as white blood cells and platelets, increase the viscosity, the thickness of the blood, which causes headaches, anginal chest pain, and difficulty breathing as a result of hypoxia and or occlusions of blood vessels. The client is at risk for thrombosis, emboli, and hemorrhage. Other symptoms include hypertension, vertigo, and enlargement of the liver and or spleen. Polycythemia can occur at any age but increases with age and is generally seen in individuals older than 60. Super important to know that. Clotting equals heart attacks or strokes. Okay, secondary polycythemia can be related to hypoxic lung diseases such as COPD or the result of living in an elevated altitude. Chronic hypoxia, abnormal red blood cell structures, and malignant tumors can be the underlying disorder of secondary polycythemia. COPD is a big thing in this country. Keep an eye on that. Make sure you always check their H&H, their hematocrit levels. Okay, then it talks about all kinds of different things. So treatment, basically the treatment is to either do a blood thinner or just to constantly have them donate blood. Get the excess blood out of their system. Okay, next is anemias on the top of page 1462. I love you. So anemia, one of the most common hematologic problems affecting people of all ages, is defined as a condition of a lower than normal level of hemoglobin and fewer than normal red blood cells within the circulation. It's not considered a disease in itself. It's just a disorder, not a disease. It can be a manifestation of many abnormal conditions. such as the following. So dietary, bone marrow damage, malignancies, chronic infections, overactive spleen, bleeding from any organ or tract, hereditary disorders. So all kinds of different things. So the seriousness of anemia depends on factors such as its speed of onset, whether it is chronic, and the client's overall health and nutritional status. The more rapidly anemia develops, the more likely it is to be serious. Those are things to remember. So just know, severe anemia would be indicated by a drop of hemoglobin to less than 8 grams per deciliter. That's on the page of 1463. Hi. I'm recording a video for class. You can come in. Do you want to take her? She just had a big poop. Okay.
You're recording a video for your class?
Yeah. This is my baby. How was work?
It was great.
Oh, you're amazing. I love you. Okay. I'll be out hopefully soon.
When are you going to be done?
Hopefully I don't know. I'll say 10-15 minutes. Sorry. Okay. So, again, severe anemia would be indicated by a drop of hemoglobin to less than 8 grams per deciliter. So, there's a nursing alert that talks about the pulse ox, reflects the ability of the red blood cells. Just know that the pulse ox is great in a very healthy and normal person. Anybody with any sort of abnormalities, it could be not as a great indicator of their actual oxygen saturation. Always just keep that in mind, okay? So we have iron deficiency anemia. It's the most prevalent anemia in all age groups in the world. It results from either an inadequate absorption or an excessive loss of iron. Great. Hemolytic anemia. Hemolytic anemia is caused by destruction of red blood cells before their normal lifespan of about 120 days. Blah, blah, blah. Acute hemorrhagic anemia. Acute hemorrhagic anemia develops after a rapid and often sudden blood loss. Causes of such blood loss include trauma that leads to blood vessel rupture, aneurysm, or artery erosion caused by a cancerous lesion or ulcer, okay? So just know that a loss of 30% of blood volume will cause failure in the circulatory system, coma, and shock. A loss that reaches 40% can be imminently fatal. So hypovolemic shock, super important to replace that circulatory volume. So blah, 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 blah. Then on page 1464, it talks about all kinds of cool things with anemia. Again, page 1465. Chronic hemorrhagic anemia is usually the result of conditions such as peptic ulcers, bleeding hemorrhoids, excessive emesis, or cancerous lesions in the GI tract. Chronic blood loss can eventually lead to iron deficiency anemia because available iron sources are depleted. Treatment usually includes controlling the site of bleeding and replacing lost iron through diet and supplements. So, pernicious anemia is caused by a lack of gastric substance called intrinsic factor, which is produced in the stomach. The body needs intrinsic factor to absorb vitamin B12 from food in the small intestine. Vitamin B12 is necessary for the body's proper absorption and use of iron and for the protection of nerve fibers. Quick history. So B12, they say that vegans are super low in B12, and that's true because nowadays B12 is found in a lot of like animal products and everything like that. However, before the overproduction of farms and over the production of all that, people would farm their own food for the most part, and they would literally just take the carrot from the ground or whatever, I'm just being really hypothetical, wash it off, but there'd still be dirt in it. Now, the dirt would have vitamin B12, mind is blown, and then people would ingest it that way if they mostly ate a vegetable diet. So just a heads up, if you are vegan, do your thing, that's awesome. Take a supplement. Nowadays, they have a supplement that you can just put under your tongue and it dissolves. You can get it at Costco. Anyways, B12 is great, even if you don't think you're insufficient of it. Everybody's insufficient of every vitamin. Okay, blah, blah, blah. We'll get into that later. Okay, so just know, pernicious anemia develops slowly. Therefore, signs and symptoms are usually severe when a diagnosis is finally made. Let's see here. So people that are low in B12, in this indication, pernicious anemia, have to get injections usually because the orally, they lack the intrinsic factor necessary for absorption. So they also have to take iron supplements and folic acid for the rest of their lives, which is a good, not a bad thing. Know this: iron, B12, and B9 are necessary or are needed for the production of hemoglobin in the body. Iron, B12, and B9 are necessary for the production of hemoglobin in the body. Okay, aplastic anemia. Aplastic anemia or bone marrow depression describes a condition in which the bone marrow is underdeveloped or has failed, resulting in a decrease in red blood cells, white blood cells, and platelets. So some researchers believe that some cases of aplastic anemia may be autoimmune in origin. The client with aplastic anemia is extremely susceptible to infection and bleeding. Anybody that has it, that you know that diagnosis, tell them, stay healthy, don't get hurt. So blah, blah, blah. Page 1466, sickle cell disease. Before I move on, figure 82-1. Look at that pretty red blood cell in the top left corner, and you got that terrible looking one there. That's sickle cell disease. Think of how exhausted they must be because their body can't transport oxygen efficiently throughout the entire thing. So anyway, so sickle cell disease, also known as sickle cell anemia, is a genetic disease in which the person's red blood cells become crescent or sickle-shaped because of a mutation in the hemoglobin gene. So sickle cell anemia develops owing to hypoxemia and damaged red blood cells. Another thing that's super important to know, if your patient has a history of this, it's bound to happen again, is what's called a sickle cell crisis. It occurs when the deformed red blood cells collect or aggregate in small blood vessels. These occlusions are painful owing to the hypoxic state of the affected tissues. Permanent damage to organs can develop. This is also very painful. So basically, their little red blood cells congregate, let's say in their wrist or their wherever it is, no blood circulation there, it's going to be painful. Sit on your foot for about 20 minutes and you're going to be like, this is awful. Think of what they're going through. Pain medication is usually a necessary thing. They also need to be taking lifelong folic acid if they have sickle cell disease. And then there's what's called thalassemia. I've never seen it in my clinical setting, but it exists. So it's anemia characterized by deficient and damaged chains of hemoglobin. So, as with sickle cell disease, these disorders are associated with geographic areas of ancient endemic malaria. So usually in those areas is where you're going to see a lot of this, or if they have descent there, then you'll see that too. Okay, so then it talks about all kinds of things. Okay, so white blood cell disorders on page 1467. You have what's called neutropenia and agranulocytosis. Neutropenia, whatever you say that, also known as granulocytopenia, is a decrease in neutrophils, one of the forms of leukocytes. So then it talks about more about it. So just know that also it can be acquired or congenital. Usually radiation therapies for cancer can also cause neutropenia. Idiopathic cases, basically of unknown cause, of neutropenia may be related to autoimmune disorders in which antibodies react against the normal human leukocyte antigens on white blood cells. It talks about the signs, symptoms, treatment, and considerations. Leukemia. Leukemia is a malignant hematologic disorder of both children and adults that is characterized by an abundance of abnormal white blood cells. So, with all types of leukemias, abnormal white blood cells take over the normal marrow. So, red blood cells and thrombocytes are also affected. Leukemic cells can proliferate and be released into the peripheral blood, invading body organs, causing metastasis, which means spreading out. In summary, the main types of leukemia are acute lymphoid leukemia or chronic lymphoid leukemia, or acute myeloid leukemia or chronic myeloid leukemia. And then it talks about the signs, symptoms, treatment. Basically, someone's exhausted, they don't feel well, really random, they go in, their white blood cells are just crazy. Okay, so then let's turn the page to page 1468. Platelets and clotting disorders. Platelet disorders can include too many thrombocytes, thrombocythemia, and too few thrombocytes, thrombocytopenia. So thrombocythemia, which is the too many, the disease is not diagnosed and may not be treated unless symptoms occur. So they don't really know they have it until the symptoms. Causative risk factors including smoking, peripheral vascular disease, atherosclerosis, and the previous formation of thrombi. So that's cool. Then you have thrombocytopenia, is a stem cell disorder of the bone marrow, is diagnosed when a client's platelet count falls below 50,000 cubic millimeters. That's important to know. Thrombocytopenia, diagnosed when it falls below 50,000. Thrombocytopenia is too little platelets. The causes may be unknown. It also could be from other things. Let's see here. And then it talks about idiopathic thrombocytopenia purpura. Long names. Cool. So acute idiopathic thrombocytopenia purpura, ITP, commonly occurs after a viral illness in children. So something super bad, it may develop after that. Thus, it may be an autoimmune disorder in which the individual develops antibodies to his or her own platelets. Yikes. Signs and symptoms, nursing consideration, signs of bleeding. Basically, stop the bleeding if you see that. I like the signs of external bleeding, the purpura, petechiae, epistaxis, cool stuff. Okay. So then it talks about, I'm on page 1469, nursing alert. Because blood does not clot correctly in clients with bleeding disorders, even a slight injury can result in a serious hemorrhage. Watch for signs of internal bleeding, such as unusual pallor, rapid pulse, restlessness, and a drop in blood pressure. Protect these clients against injury. So, next we have DIC, disseminated intravascular coagulation. It's a complex and potentially fatal disorder in which clotting occurs in the microvascular system, small clots inside blood vessels, and at the same time hemorrhaging develops. The disorder usually has a rapid onset, further adding to its severity. It is not a disease, but a result of serious defects in clotting mechanisms related to underlying disorders. Way to remember this. Okay, I don't remember if I told you the story. If I did, you're going to hear it again. Okay. So, for example, DIC can be caused from many things, and usually it's from it can be from a toxin. So, couple been out drinking, they're driving on the highway, out in the desert. The wife's like, hey, I gotta go to the bathroom, can you pull over? She goes down the little ditch, she squats in the bushes. All of a sudden, her husband hears her screaming, and she goes, I just got bit, I think I got bit by a rattlesnake. He throws her in there, and they're screaming down the highway. And she is just starting to bleed from every single orifice, like everything. This will make you bleed like crazy. True story. So basically, though, ways to treat it, it almost seems counterproductive, but heparin is important because heparin will keep those little clotting of the blood vessels thin to prevent any clotting from happening anywhere else or blockages to happen from anywhere else. And then your goal is to simply treat the toxin or treat the source of what's causing the DIC, give them that heparin, and then throw a Hail Mary. That's what you're thinking. Okay, so, and then also really quick, I'm going to talk about this handout a little bit later. Look for the rhabdomyolysis handout, okay? That'll come up a little later. Okay, anyways, DIC, rattlesnake bite, bleeding. Okay. Page 1469 again, we have hemophilia. It's a sex-linked genetic disorder in which the person's blood is slow to coagulate because of a lack of clotting factor 8. So slow to coagulate, basically you just kind of keep bleeding if you don't stop the bleeding. So almost all affected individuals are males. Children with hemophilia are generally healthy but are always at risk for bleeding. Okay, so nursing considerations for these kiddos or for anybody that has it. Prevent injury if possible, and methods of administering the factor 8. Concentrate at home if appropriate. If you have a kid that has it, just tell them, hey kiddo, be smart about it, don't bleed. I mean, whatever you want to. Okay, then we have an NCLEX alert on the top of page 1470. So bleeding disorders present challenges to nursing care, most definitely, because there's so many, and you just have to like brush up on them every single time you see a patient with a diagnosis of that. So just be aware of how to treat them. Let's see here. So then there's von Willebrand disease. It's the most common hereditary bleeding abnormality in humans. There are 4 inherited types of the diseases and is more common in women. So the disease is a result of a lack of sufficient or poor quality von Willebrand factor, which is required for platelet adhesion. I don't know the history, but I'm pretty sure some royal kids back in the day in Europe had a bunch of these weird like types of anemias, and so that's why they're like always like Sarah careful and blah blah blah. Anyways, and there's like a lot of like royal history with this kind of stuff. Yay. Okay. Lymphatic system disorders on the bottom, page 1470. We're almost there. So you have different things. So just know that Hodgkin lymphoma or Hodgkin's disease is a malignancy of the lymphatic system. So there's all kinds of things with that, but just know that Hodgkin lymphoma eventually involves the development of abnormal cancerous B lymphocytes called Reed Sternberg cells, which proliferate within the lymph system. B cells are extremely important types of specific lymph cells that fight against antigens. B cells work with another type of lymph cell, the T cell. T cells are needed to fight infection. The Reed Sternberg cells grow, eventually spreading beyond the lymphatic system, and thus compromise the body's ability to combat infection. Treated Hodgkin lymphoma has a high cure rate. Good. And then it talks about different risk factors, the diagnosis, the signs and symptoms, and the treatment, and blah, blah, blah. So just know, Hodgkin lymphoma has Reed Sternberg cells, whereas non-Hodgkin lymphoma, they do not have the Reed Sternberg cells. So non-Hodgkin lymphoma are a group of lymphatic neoplasms that include any kind of lymphoma except Hodgkin lymphomas. They're more common than Hodgkin lymphomas and do not have the Reed Sternberg cells. The cause of NHL, non-Hodgkin lymphoma, is unknown, but the disease occurs with abnormal lymphocytosis. These abnormal white blood cells grow, divide, and eventually overcome lymph nodes, which is the cause of lymph node swelling. Most NHLs arise from B cells. So risk factors for NHL include immunosuppressive drug therapy, pesticide exposure, and age greater than 60 years old. Then it also talks about the Helicobacter pylori bacteria associated with gastric ulcers and viruses. Then all the kind of good information. Just know, special consideration lifespan. So as the older we get, the more complications that can happen, etc., etc. It's important to know these things with our aging population. The older adult with either Hodgkin lymphoma or NHL may experience altered or impaired renal, cardiac, hepatic, or respiratory function caused by the aging process. Remember that many of the treatment options for Hodgkin lymphoma and NHL may also cause impairment of these organs. Monitor these clients carefully. Dose, schedule, or treatment changes and limitations may be indicated. Always keep an eye on your patients and just brush up on anything that's going on with them. It's never a bad thing to not know what something is. Just look it up, brush up on it, and be aware of it and know the signs and symptoms, etc., etc. It's just being a good nurse. So, multiple myeloma. It's a malignant cancer of bone marrow caused by malignant plasma cells. So plasma cells are the most mature form of B lymphocytes. So basically, it's a very slow onset. So the individual may be without symptoms until the disease is advanced. The survival rate is 3 to 7 years after diagnosis, depending on the onset of treatment. Infection is the usual cause of death. So with multiple myeloma, the plasma cells are abnormal and they develop and proliferate in the bone marrow. That sucks. Then it talks about the diagnosis, the signs and symptoms. So diagnosis of multiple myeloma, it's important to remember these 4 things. The abbreviation is CRAB. Just know the mnemonic CRAB will reveal the 4 most common diagnostic symptoms: elevated calcium levels, C, R is renal failure, A is anemia, and B is bone lesions, okay? Bone lesions or bone fractures. Oh, we're done. Ah, great. So then treatment, nursing considerations. Yay. Okay, so quick handouts I wanted you to look at. Rhabdomyolysis. This pertains to the DIC, disseminated, what does that stand for? Intravascular coagulation. Okay, so what is rhabdomyolysis? It's the breakdown of muscle because of either injury or staying down for too long or just any sort of like muscle exertion. Basically, you're going to see this a lot. I saw this in a patient who had a fall at home. He lived alone. He wasn't on the ground for, I think, 2 days. Super sad. He came in. His urine was like, it was like rusty yellow. It was brown. I was like, whoa. And they're like, that's rhabdomyolysis. That guy had a breakdown of muscle from being on the ground in one position for so long. So just know that, so complications of rhabdomyolysis also include DIC, a condition, so we talked about that. It was discovered in 1908 during World War, or in a volcano eruption in Italy. Kind of cool. DIC, so it's often a complication of major medical events such as trauma or other illnesses. It's recognized during evaluation of the patient. So just kind of cool things. It's also seen in sickle cell disease and other things. So yeah, cool handout. Good to know. You will see this. Okay, the other handout. Why don't you even look at this one? It's the type of, sorry, this guy right here. I like this one a lot. It basically tells you there are 3 main types of blood cancers, like we've already talked about: leukemia, lymphoma, myeloma. Then it talks about the different origins, cell types, and characteristics of different diseases: leukemia, lymphoma, myeloma, and then different things that talks about it, okay? Really cool, really easy to break down in the chart setting. The back side of this talks about the different types of white blood cells. The mnemonic to remember them: never let monkeys eat bananas. Neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Great! So then it kind of talks about different things. The bleeding time is the platelet response. The clotting time is the coagulation response. Good to know. This is a good handout. Review it. Remember it. Awesome! Okay, and then another way to remember different things is the 7 types of anemia. This is great. One of the ones that we didn't talk about, though, is on the second page, called Fanconi anemia. Just be aware of it. Awesome. Okay, it's very rare. And then otherwise it talks about different things. It just kind of breaks it down and it's easier to look at and all that kind of stuff. So again, I will post any sort of information and points that I want you to remember in the description box. If there's any questions, you know how to get a hold of me. You guys have been great, and hopefully I didn't talk your ear off. Okay, see you next time.